So, Román, good to see you as well.
Good to see you.
And we met last week at LOCOMOTION Away Day.
We did.
Yeah, it was great to meet you again. So, Román, I was going to ask you, obviously, Paul, your CEO, had this vision for a platform for PROMs, which people can use and it'll be useful during the pandemic. But it has had such good impact in the last couple of years, including kind of national health authorities. And you're kind of instrumental in bringing about that impact. Can you tell us a little bit about that? How did you do that magic?
Yes, I suppose where to start. You know, the pandemic through lockdown obviously presented loads of different challenges. You know, remote working, not being able to kind of meet people directly or face to face. And, you know, there was a kind of glaring need for digital technology for people to be able to access, you know, healthcare or healthcare solutions at home. And we really had to kind of think outside the box, but kind of a way of merging, you know, the science developed at University of Leeds with your team on long COVID, with the kind of pre-existing technology that we already had, you know, focused on neurology and other conditions, to develop something quite unique in terms of a digital platform that could be accessed by anybody, you know, on any device, and provided they didn't have a digital device, there are alternatives to address that digital exclusion, which would allow staff members in these long COVID services to still, you know, communicate with patients and kind of get the information that they need to, you know, provide quality services.
Do you think, what's the future? Do you think this will transform how PROMs are collected? Because this is something new, isn't it? Like patients having control, they are filling out the PROMs, the clinician is accessing it, and it's sitting outside pretty much the healthcare system. Do you agree to that, and do you think that is the future?
I agree to an extent. I think, you know, what we've seen is that it works for some patients. It works for, you know, different age groups, you know, whatever their background is. But we do recognise that, you know, there are people, you know, with certain circumstances that would prevent them from accessing, you know, their own personal devices. So then, how can we support those at home? So I think to an extent, you know, this kind of digital first approach will help, you know, the majority of patients, and people really are responding to this. But we have to recognise that other people, you know, still need that helping hand, either from, you know, a parent, a guardian, a carer, you know, telephone conversations, and in some cases at-home visits or face-to-face appointments. So I think these will still, you know, stay around for, you know, at least for the foreseeable. But we are, you know, fortunately seeing a lot of, you know, positive feedback and uptake in kind of self-management solutions, you know, such as our own. But we do recognise there's an immediate need or demand to support patients, or rather sufferers that have been unable to enter the healthcare system in their local area, in their country. And you know, we're looking at addressing this, particularly long COVID, in the short term, to help people, you know, that perhaps are in countries or areas that don't have a long COVID service. Then how can we, you know, share this technology or this science, and ultimately kind of provide care to those at home that can't access, you know, a family doctor or a healthcare service.
So I know you're very modest, but the beauty for me throughout these last couple of years, Román, has been how you've shown that kind of entrepreneurship, and you're now liaising with NHS England, NHS Scotland, and I don't know, so many other countries you're dealing with, and you're also doing a fellowship in University of Leeds. So really well done, really pleased with your progress. Thank you very much.
Thank you very much.